740. We've all seen commercials for banks bidding against each other to give you the lowest mortgage rates. But would you want doctors to try to outbid each other to become your surgeon? As we told you Tuesday on Trending, it's happening. NBC's Janet Shamlian has more.
It's a whole new kind of doctor-patient relationship.
24 million.
Usually associated more with fine art than the medical arts. There's now a website called Medibid, where doctors can go to auction their surgical services.
For the person who is looking for what I have to offer, it's a good way for us to find each other.
Dr. Adam Harris is an orthopedist in San Antonio. He thinks Medibid is a win-win.
My goal is to take care of individual patients as if they're family, and I charge a reasonable fee for high-quality service.
It may seem more like eBay than ER, but with medical costs soaring, it's catching on.
It was constant pain. I was eating Advil like it was candy.
Perry Hunt needed a hip replacement. His health insurance wouldn't cover it, and the surgery cost $70,000. Hunt found Medibid, and for a $25 fee, explained what he needed done. Dr. Harris came back with a bid of $21,000 for the same procedure.
I read a lot of reviews, and every review that I read was positive, so I knew that this was going to be my guy.
I was underbid by another surgeon by, I think, $6,000. But he found value in what I had to offer and came to me for that reason.
Dr. Harris says potential patients have to come and see him for a full evaluation before he'll take their case.
For its part, Medibid says it doesn't check out the doctors who bid for business on this site. They say it's up to the patients to do their homework and to ask questions.
That's a lot of risk to take with your own life.
Medical ethicist Dr. Arthur Kaplan says the idea of bidding on the internet may sound great to some people, but cheaper in medicine often means not as good.
We have more information when we buy a car at an auction than we buy a surgeon at an auction.
But Perry Hunt says he's happy. He's got a new hip, and he saved $50,000.
It cost $21,000 for the surgery, just as it was advertised on the site, and it all happened smoothly. I think it's a great thing.
For today, Janet Shamlian, NBC News, Houston.
Dr. Marty McCary is an assistant professor of surgery at Johns Hopkins and author of Unaccountable: What Hospitals Won't Tell You and How Transparency Can Revolutionize Healthcare. Doctor, good to see you. Good morning.
Good to be with you.
I get the economical side of this. You know, that's a lot of money to save. I'm a little queasy on the quality side. How do you feel about it?
Well, you know, increasingly people are frustrated with the healthcare system because it's one of the only businesses where you can't get a bid on a service. And you don't even know what you paid for afterwards. And people are saying we want a more free market with price transparency. And there's demand for that out there. I mean, I tend to think if you're paying more, maybe you're getting more quality. But people are hungry for price transparency out there in some fraction of the healthcare market.
Let's talk about it. The expression is you get what you pay for. And I'm okay with that when I'm shopping for a car or a vacation or something. I'm not sure I'm okay with that when I'm shopping for surgery.
Well, one thing that's missing from these websites is any metric of quality or performance. And if you're just shopping on the basis of price, it creates a market incentive to just cut corners on price. Now, I'm sure there are folks out there that are doing quality procedures on these websites, but you don't know. You're flying blind.
All right, so if you're considering bidding online for surgery, what do you need to know going in, and what questions do you need to ask the person who's doing the bidding?
Well, same thing as with any procedure. How many have you done? What's the backup? What happens if something goes wrong? Do you have another surgeon, a partner, a senior, another hospital where you could be transferred to? And ask a nurse who doesn't work with the doctor, who would you have your surgery?
The guy in the piece was having hip replacement surgery. What surgeries would you say it's okay to use a website like this? What would not be okay?
Well, I'm concerned about any website that doesn't list quality metrics, but if I were going to use something like this, I would think a very low risk, perhaps a skin tag removal when you're on a trip. If you've got family at a destination and you're not going there, totally blind to what the culture is there. A lot of people are going overseas for their medical care, and the AMA and CDC have put out resources now saying, here are some important questions you should ask. Up to 1 million people travel overseas for their medical procedures.
Even with questions, you and I both agree, probably going to see more of this in the future.
Absolutely.
All right, Doc, thanks very much.
Thanks.
Appreciate it. And coming up at 8:13.